I'm Dr. Rajiv M. I'm working as a nephrologist in Sunshine Hospitals for the last 3 years. I did my MBBS from Usmania Medical College, Hyderabad. I've done my MD in General Medicine from Nizam's Institute of Medical Sciences, Hyderabad. And I've done my DNB in Nephrology from Medcity Hospitals, Hyderabad. I'm working here as a nephrologist, and the thing I do as a nephrologist is I take care of patients with kidney problems. We have a department here, Dr. Anuradha and myself, that deals with these issues. Now, what do I do as a nephrologist? So there are many kinds of kidney problems that come here. For example, you have a patient with acute renal failure, someone who has a sudden shutdown in renal function after an illness, and it is your job to make sure that this patient recovers his renal function fully. That's a challenge, and that's the challenge of treating acute renal failure. You also have patients with glomerular disorders. Now, what do we mean by glomerular disorders? It means there is a problem in the filtration part of the kidney, and this leads to proteins leaking out. The patient may come to you with swelling of the body, and it's your job to make sure that this patient's kidney recovers and he has a long and healthy life. There are other disorders also, like tubular disorders. A patient may come with a mysteriously low potassium, and it's your job to figure out why this is happening and make sure that he continues to have a normal electrolyte balance throughout his life. Some patients have kidney stones. A urologist typically deals with the removal of the stone, but as a nephrologist, you try to figure out why this patient had a kidney stone, what can be done to prevent it, and what can be done, for example, to make sure that he doesn't have a kidney stone over the next 10 years. But the bulk of my practice and my main interests lie in 3 fields. One is chronic kidney disease. These are a group of patients who have kidney diseases which are running in their body for quite some time, a few months at least, and it's your job to make sure that the life of these patients' kidneys is prolonged. And if unfortunately these patients require dialysis, it's important that you give them both quality as well as longevity of life by doing dialysis that is appropriate, safe, and very humane. My main interest, the other one, is intensive care nephrology. What do I mean by intensive care nephrology? You have patients who are critically ill who are also having kidney problems, and it is your job to replace their kidney function in the ICU setting, and you cannot do normal dialysis in many of these patients. You have to do a kind of dialysis which is called continuous renal replacement therapy, or CRRT, and this is very challenging. This is dialysis that you do 24 hours a day, and this is one of my interests. But my biggest satisfaction and the reason why I became a nephrologist is because of renal transplantation. Renal transplantation allows you to replace a person's kidney fully and give him a normal life. And this is something that you cannot say for other organs so easily. But we do renal transplantation quite routinely here. We do both live related as well as cadaveric donation transplants. And we have very good outcomes with both of these modalities. And the biggest joy that any nephrologist can have is to see a patient walk out with a normal kidney and with the hope of a normal life ahead of him. The facilities that we have in Sunshine Hospitals easily match the best that is there anywhere in India. We have a state-of-the-art dialysis unit. We have the latest dialysis machines, and we are able to do dialysis in a very smooth and humane manner for the patients. We have state-of-the-art CRRT machines that help us do dialysis in the ICU setting. We are also able to do peritoneal dialysis for many of our patients, both acute peritoneal dialysis as well as continuous ambulatory peritoneal dialysis. For diagnostic purposes, we are able to do renal biopsies, and we send our biopsies to perhaps the most experienced pathologists in Hyderabad. And we are also able to do special kinds of dialysis. For example, in the ICU setting, you have a patient who is suffering from either a poisoning or who is having severe endotoxin mediated shock, and it's quite a challenge to remove these chemicals from the body without affecting the body itself. And this is something we do quite routinely here. These are some of the facilities we have in Sunshine Hospitals. We have a very modern kidney transplantation unit that is a dedicated suite for our transplant patients, and we keep our transplant patients in an ICU setting with 1:1 nursing, and we keep them all throughout their hospital stay, and we are able to achieve very low levels of infection rates and very low levels of morbidities and mortalities because of the infection standards that we have in our nephrology unit.